Hi, this is Rebecca, and today we're going to give a brief overview of equine nuclear scintigraphy, otherwise known as a bone scan.
So the test is performed when a horse is presenting some sort of lameness, unsoundness, or performance issue. The horse is taken to an equine hospital, the horse is then injected with a radiopharmaceutical, and then the body is scanned with a gamma camera. Increased uptake of this radiopharmaceutical is called a hotspot, and hotspots indicate areas of osseous abnormalities, either in the joint or the bone. And these areas in the joint or the bone can be causing the lameness or pain. A normal bone scan, meaning there was no findings on the bone scan, would indicate that the lameness is more likely due to connective tissue, such as muscle, tendon, ligament, or fascia, or it's a neurological condition. Scintigraphy is particularly useful in the following situations. One, when the vet is trying to interpret how relevant some X-ray abnormalities are, so help to clarify some X-rays. Nuclear scintigraphy is also useful to help make a diagnosis in a horse with normal X-rays. So the vet suspects a problem with a particular area, the X-rays show normal, they'll do a nuclear scintigraphy to help clarify that. They will also use it for horses that do not block out using nerve or joint blocks. So in horses, a way to figure out actually where the pain is coming from, they will inject a numbing agent into various points along the leg and wait for that to take effect and see how that affects the lameness. That's what we call joint blocks or nerve blocks. If a horse does not block out, meaning they are still unsound after the nerve blocks, they will then wait a period of time and they'll do a nuclear scintigraphy to try and make more sense of why the horse is unsound on that limb but did not block out. They'll also use nuclear scintigraphy for horses that have multiple lame limbs. So if they have two limbs that are bothering them, they really want to get a better picture of why that is, and they'll use nuclear scintigraphy. Another issue with horses is that they may not be what we call quote unquote lame. So they might not be limping on a particular leg, but they are having performance issues. So they're not able to perform at the level that they were performing before. And nuclear scintigraphy can help figure out why that is, why their performance is decreased. It's also very helpful in stress fractures, especially acute situations where the abnormality may not show up on a radiograph quite yet, but it will show up on a nuclear scintigraphy. It is also helpful with pelvic, back, and neck issues if those areas are suspected, and part of that reason is because it is very hard to get a good view of those areas radiographically, especially the pelvis, because of such density of the tissues. And another reason why the vet might use nuclear scintigraphy is for chronic vague lameness, where other diagnostics have been performed, but they have not been able to find a reason for the condition, and so therefore they're going to use nuclear scintigraphy. The only risk that's really been reported in the literature is due to the sedation of the horse, not actually due to the radiopharmaceutical. The radiopharmaceutical is thought to be quite safe. I will say from personal experience that nuclear scintigraphy has its place, but sometimes it can actually confuse the picture a little bit because it is not the end-all be-all that you sometimes would hope it would be when you're the owner and you're trying to figure out what's wrong with your horse. And sometimes things can show up as hotspots that are not relevant to the chief complaint. It's still useful to know them and to address them, but sometimes it can help it can not help because it actually muddies the waters even more.